Pleasingly, New South Wales has already completed 86.7% of first doses in our 16 and over population, and we're inching closer to that 90% first dose, and looking forward to that important day. In terms of second doses, we're up to 62.9%. So we'll definitely hit that target by Monday, the 11th of October, of opening that day. So I ask everybody to remember what you can do at 70% and make sure we stick to the rules then. In terms of 12 to 15-year-olds, we have 47.6% who've received their first dose, given that's only been available for a couple of weeks. Can I thank all the parents and students and young people who've come forward to get vaccinated? These vaccine rates are continuing at good pace, and pleasingly yesterday, as Dr. Chant announced, anybody in New South Wales over the age of 12 is now able to receive a Pfizer or a Moderna vaccine from their GP or a pharmacist or from a New South Wales health hub. And we really want to make sure that if you're someone who hasn't had any vaccine, please come forward and get vaccinated. A proportion of 12 to 15-year-olds are vaccinated. That will change the way in which we deal with cases potentially at school, and there'll be further advice provided in relation to that matter. I also want to foreshadow, whilst we won't be announcing anything today, that the government is considering bringing some things forward from the 1st of December to 80% double dose. There won't be major things, but there will be tweaks. And we'll announce that once we get to 70% double dose. But I do want to foreshadow, I know there are a number of people in the community who've asked for us to consider certain things, and health is considering those things. And if it's safe to do so, we'll be able to resume some of those activities at 80% as opposed to 1st of December, I should say. And finally, I'm really pleased to have the New South Wales Treasurer here with us. The New South Wales Government takes enormous pride in supporting our business community during what has been a very difficult time. And whilst there are certain sources of funding which the Commonwealth understandably is not providing beyond a certain point, the Treasurer has done a lot of work as to how we can continue to support small businesses during this difficult time, especially between 70 and 80%. And I just want to emphasise again what we've been saying week on week. We're all looking forward to that 70% double dose Monday, the 11th of October. But between 70% and 80% double dose, which we anticipate will only be 2 or 3 weeks, we ask everybody to be extra safe, extra cautious. Yes, it's fantastic we'll be able to do so many more things we hadn't been able to do before, but at the same time, we need to be cautious until we get to that 80% double dose vaccination. So now Dr. Chant will provide the health update. The Treasurer will give some good news to businesses across New South Wales, and then we'll take your questions. Thank you.
Thank you, Premier. So New South Wales recorded 941 locally acquired cases of COVID in the 24 hours to 8 p.m. last night, and 1 overseas acquired case. And there were 120,993 COVID tests were reported to 8 p.m. last night. There are currently 1,090 cases admitted to hospital, and we have 213 in ICU, spanning all of those age ranges. In terms of the suburbs of concern, so whilst we've been indicating that we're pleased with the decline in cases in some of our suburbs in southwestern Sydney and Western Sydney, now is not the time for complacency. We are seeing concerns around Marylands, Bankstown, Lamia, Revesby, Fairfield, Woodbury, Mount Druitt, Liverpool, Unanderra and Yagoona. It is important that everyone presents testing and that everyone takes this opportunity to get vaccinated. We're particularly calling upon young people in that age group of 16 to 39. It is critical. You haven't had the opportunity to be vaccinated for a while. Please take those opportunities now. It will protect you. It will protect your loved ones. But also because you are the connector across generations, you do contribute more to transmission. So please get vaccinated. Sadly, we've had to announce the death of 6 people with COVID, 4 men and 2 women. 3 people were in their 70s, 2 were in their 80s, and 1 person is in their 90s. And can I pass on my condolences to their loved ones? 2 were from southwestern Sydney. 1 person was from Sydney's inner west, and 1 person was from western Sydney. And 1 person was from southeastern Sydney, and 1 person was from north and northwestern Sydney. 4 people were not vaccinated, and 2 people had received 1 dose of a COVID vaccine. In terms of sewage detections, we've got sewage detections in Gunnedah, Tweed, Benora Point and South Grafton in northern New South Wales, Goolong in western New South Wales, Ayrton in far west and Moruya and Thredbo in southern New South Wales. We are seeing an increase in cases in our regional areas, and again urge everyone in regional areas to take the opportunity to get vaccinated as quickly as possible, but also to please keep presenting if you have any symptoms of COVID. In Illawarra, there were 82 new cases, and again in Hunter, we're seeing an increase in cases to 82 new cases. Thank you.
Thanks, Kerry. Well, it's obviously been a very difficult time, but I think we are certainly coming up to a very bright summer here in New South Wales for all our businesses and workers right across the state. We always said from the outset that success for New South Wales won't be the budget position, but keeping as many people in work and as many businesses in business during this difficult time. And that's why today the New South Wales government is pleased to announce that whilst we are tapering down with the federal government, the support package for JobSafe from between 70 and 80% double dose vaccination, the New South Wales government will maintain its contribution to that program until 30 November. We know that when we do open up at 70% and 80%, that there will be still some restrictions in place, that businesses will not be operating at full capacity. So by maintaining the New South Wales government's contribution to the program, it will allow this has cost the budget substantially during this period. We have always, as a government, had our number one priority to keep people safe, but providing this financial support will give us sustained cash flow to help them as they open up, as to what I expect our state not just to have a strong economic rebound, but to come out stronger the other side. So today is a great announcement for businesses right across the state. It gives them the certainty of having that cash flow from the New South Wales government as we reopen into a bright summer.
How much is this 6 week in itself going to cost?
Around five to New South Wales,
yep.
Around $500 million in terms of the extensions. That's included in the $8 billion expectation. Ultimately, though, Tom, we'll also expect to see many businesses fall out of the system as they open up. So the 30% turnover requirement, a reduction is still in place. We will be asking businesses on a fortnightly basis to provide information to Service New South Wales that they are still eligible, and there's two key criteria there. One is that they still qualify due to a 30% reduction in turnover, but also that they've kept on their staff. And as you know, we said from the outset that our preferred position was that the JobKeeper program was in place, and part of that was to keep that nexus between the employee and the employer. Part of the agreement with the federal government, which obviously we appreciate here in our state, and we thank them very much today for the support they've provided during this period, that employers, in order to qualify for these payments, need to keep their workers on the books. So they need to obviously confirm that every fortnight through the Service New South Wales process.
173,000 jobs lost in the past month. Are you disappointed that the Commonwealth is not extending with you?
Look, I appreciate the support they provide for our state, but ultimately, as a state government, where our number one priority is to keep our people safe, we have restrictions in place. It's been a very difficult time, and the decision that the Premier and myself and our crisis cabinet has made yesterday is to keep our support going.
But in your opinion, it's too early because you're extending, but the Commonwealth government is not.
Well, we also, at 50% post 50% contribution, post the 80% double dose, there's no doubt that those support payments need to be taken down because businesses will be open again. Most businesses across the state will open up. Trade will begin again. That will be a great thing. But our government's position is all, and I thank the Commonwealth governments for their support during this period. I mean, it's been budgets around the country aren't looking too great now, but we have said and are completely committed. Success for me as Treasurer has been at the end of this pandemic. What is the unemployment rate, and how many businesses have we kept open? That's what success is. And so it was a very easy decision for me to recommend to Crisis Cabinet yesterday that we keep our contribution going up to 30 November when we will have opened up most of the restrictions that were in place.
What about those businesses that are...
what about those businesses that are reliant on international tourism? Bridgeclimb, for instance, it's all international tourism. Are they going to survive?
Well, obviously, and I've worked very closely with that group, as all tourism and accommodation providers have gone through a very difficult, not just 3 months, but 18 months during this period. And, we will be announcing very shortly, the Premier and I, during October, our economic recovery plan. So today is continuing our economic response, our financial support for businesses, but that will very quickly turn to our economic recovery. And that will be announced in October, and it will obviously support those industries that have had it have gone through a very tough time during this period. But I'll also say, when it comes to the tourism industry, New South Wales is on track to be the first state to open internationally. We want to lead our nation out of this pandemic, and I think the key to that has certainly been the vaccination rates. But what you will see is other states continue to shut down, that New South Wales opens up, and we're on track to do that, and that's going to be a great boom for the tourism industry, a great boom for accommodation. We know they've done it particularly tough during this period because, as you say, particularly in Sydney CBD and places like that, which are incredibly reliant on tourism for many of those businesses to survive. During our recovery phase, you will see added focus, and that continues on from last year, but an added focus on ensuring the particular tourism industry gets back on its feet. And I know the Minister for Tourism, Stuart Ayres, is doing a lot of work in this space, and I'm very confident that once again we'll rise to the top.
All right, skills career, obviously bringing it full time. One or two weeks to bring it into line.
Look, the Education Department and the health experts consider that, but we need to make sure that we obviously have fully vaccinated teachers available. We need to make sure that school communities have enough time to gear up. And also that there's enough confidence that it's safe to do so in that way, and also to give extra protection with the rates of vaccination. It's already nearly 48% of 12 to 15-year-olds that have had the vaccine. Our adult coverage is outstanding, so that extra week between the 11th and the 18th, for a number of reasons, gives school communities that extra level of protection, because we don't want unnecessary disruption. We know that there are going to be more cases once we start opening up. We also know that with the vaccination coverage, that will prevent serious illness. And we want to reduce the disruption schools go through when there's positive cases. And for all of those reasons, all those were considered, and we've been thinking about this ever since we realised 11 October was the more likely date for us starting to open than the 18th. We started looking at the schools and what was the best way forward. And after a lot of consideration and analysis of various scenarios, we did the most appropriate based on the health advice, and also based on the advice from the Education Department and the experts there. And the feedback received is that school communities still want that staggered start, but what it does mean is that every child, no matter what year of school they get educated in, will start a week before than they anticipate.
Those teachers are not ready to go.
Well, this is the challenge for governments during this difficult time. For every person that says they're not ready, there's 2 or 3 others that are saying you're taking too long. So we know that when you make a decision like this, not everyone will agree with it, but we have to make decisions based on what is in the best interest of the majority of our students and parents and families. We know that many parents will be starting to go back to some level of work on the 11th, given New South Wales is starting to open. But also, most importantly, let us not underestimate, all children are extremely resilient, let us not underestimate the impact of being separated and isolated from their friends and from that school community has had. And the quicker we can get them back into a routine, even if it's a week in a child's life, that will make significant difference to their social well-being. And so we're really keen to make sure that.
But haven't they had 14 weeks, just opportunity to take a swing, haven't they had 14 weeks to get ready?
Look, it's not just about getting ready for schools to reopen. It's also about making sure we have healthy vaccination rates amongst the adult population. We know that often it's not so much the children on the school campus that's the issue. As Dr. Chan and other health experts have often said, it's parents dropping children off at the same time and mingling with each other unintentionally. There's a whole range of factors we need to consider how children get to and from school. So all of that was considered in the decision making, and this was found to be the safest and most appropriate decision.
Do you know what percentage of teachers are vaccinated now? If vaccinated is kind of the key thing that's
holding you up from bringing it
Yeah,
further forward?
we know it's extremely high, and by the time schools go back on the 18th, there will be enough fully vaccinated teachers to ensure the school system proceeds. And also that there's enough time for fun as well. We know this is an exciting time for students and school communities, but also parents need to plan ahead.
Do you have a percentage? What is
I don't have the exact percentage, but the last time we checked, it was way above the state average. So we're confident we will not only have enough teachers, but that the population in teachers who are vaccinated is above the state average.
All the regional schools have just had
Teachers
No, exactly. And as far as, can I just make a comment on the health workers and say, I thank the health worker rates of vaccination in some local area health districts is as high as 98%. And that obviously includes people who might be on extended leave, who aren't working, people, new entrants to the system. So across the state, it's 98% double dose vaccination already. And can I thank all the health workers for expediting their vaccinations and making sure they come forward and get vaccinated. Really great result, and I'm just thrilled when I saw those figures this morning. It gave me heart because it shows, I think, how committed all of us are to moving forward together, to making our system run as efficiently as possible, especially as we face the most challenging weeks ahead in intensive care units. It's just reassuring to know how passionately our health workers, but also have got them to keep all of us safe.
So it's the treatment.
Oh, that's fine.
And if they are vaccinated, they get for the 8 until they're fully vaccinated. It will be any unvaccinated teachers.
Correct.
So parents.
Correct. Parents can be absolutely assured that every teacher who works with face-to-face teaching will be fully vaccinated.
Does this return apply to them as well, or will they go on the next about?
Yeah, the staggered return applies to all schools throughout the state, and that is to make sure we all move forward together. Look, there are always exceptions, and that might be for particular reasons, but generally speaking, that return to school will be consistent across the state.
The 2% or the 2% of unvaccinated healthcare workers today, I think, is the cut-off roughly. How many are actually going to come back to work day? Or do you have a number?
I'll have to check that figure, but remember that 2% that aren't, 2 or 3 that aren't vaccinated includes people on extended leave. It includes people who are perhaps not working at the moment. It includes people who've just come into the system who will get their vaccination. It includes casual workers who might be entering the system. So in reality, I think the rate of vaccination is actually even higher than that. So it'll be just a handful of people that it affects.
I know that more detail is coming about whether if there's an outbreak in school that they'll need to shut down, but how likely is it that we are going to see disruption in schools where it's going to be toing and froing between in-class and homeschooling for the rest of the year?
Well, I can confirm that the health officials are finalising their advice to government, which we'll make public in the very near future, about what tracking and tracing and close contacts look like for all of society when we hit 70% double dose. So it will be different. When you have 70 or 80% of your adult population fully vaccinated, it does mean you deal with contact tracing differently. So you don't have to be as cautious with close contacts. You don't have to be as cautious with a whole range of things you deal with, and that applies to schools as well. So as soon as that advice is provided to us, we will make sure we make it public to give people at least a week's notice before things start opening, what that looks like. But I do want to make clear that contact tracing and the way we deal with positive cases for fully vaccinated people will look a bit differently to what it does today. And you understand that when you have 80% adult coverage or 70% adult coverage, and by the time we open at 70%, Dr. Chan and I are crossing our fingers that we'll have 90+% of people with at least their first dose. We're hoping to get to that 90% figure of first dose by the end of next week. So by the time we open up on the 11th, that will already be in place. And that gives us confidence on how we approach contact tracing, how we approach returning Aussies from overseas. There's a whole range of issues that will be very different. And the government looks forward to providing that advice publicly as soon as we finalise those pieces of work, which we've been working on for some weeks now.
Chair, can we just ask about
20 cap decision on venues and allowing them in? Why was that change made? And you did flag earlier that you'd bring other things forward from December 1.
Yeah.
Can you tell us the industries that you're
Sure.
looking at?
So what we're doing now is obviously we've publicly announced what the 70% roadmap and 80% roadmap and what 1 December looks like. But when you're then drafting the health orders, which we've publicly made available, if there are any glaring inconsistencies, if that's the time to fix it. So obviously at 80%, when you can have a wedding at 1 per 4 square metres in any venue, it didn't make sense that you wouldn't be able to have that wedding at a place outside of a function centre. So for those reasons, the cap won't exist at 20%. So I think it's important for us to note that obviously public policy is clear on what we're doing at 70 and 80 and 1st of December, but please allow us to make some tweaks, because when you actually translate that into law is when you actually see where there may be some glaring inconsistencies. So I do want to foreshadow that the health team is considering a couple of aspects which we hope to be able to, which confidently we can implement at 80% as opposed to the 1st of December. But one thing, potentially, yes. So I will foreshadow that is one of those things we're looking at. But specifically in relation to lessons, not more broadly, we have to be very careful, because whilst we're all excited about opening up, the threat of surging, look, the cases are going to surge. We just need to make sure that occurs in vaccinated people and not the unvaccinated, because that hurts all of us. It hurts the unvaccinated person, it hurts their family, and it hurts their immediate community. So I will foreshadow that we are looking at things that can be done at 80 as you go make these laws applicable, but to make things simple and make sure the public comes on the journey with us. We know clearly what's happening at 70%. So in the week that we open up at 70%, we'll be able to make comment on what the 80% tweaks are. But I just want to be clear on those things. Please just be patient with us.
All right, there you have it. That is Gladys Berejiklian for the New South Wales press conference. Thank you for watching. Please subscribe with all notifications on. Thanks for watching.